Is CBD, is that weed?
It is not weed because it does not have THC, which is the part of weed that gets you high that most people are looking for when they
smoke something.
When they smoke weed.
Okay, well, all right. I just want to make sure because CBD, my mom, I got a Puerto Rican mom, and she always said that CBD means it could be drugs, so you don't take that. That's what she would tell me. So I'm scarred. Anytime I see CBD, I think weed, but you're saying it's not that.
Not weed.
Okay, not weed. Cool. Welcome back to Uncomfortable Questions. I'm your host, JC Mendoza, and with me again is the board-certified urologist and SVP of Men's Sexual Health here at HIMSS, Dr. Peter Stahl. Doc, how you doing today?
Pretty awesome, JC.
That's good. I'm glad to hear that because we got plenty more uncomfortable questions to go over. This one doesn't feel as uncomfortable, but I do know my mom is watching, so I'm going to be careful. Do you have any, what is CBD? Do you know what that is?
Yeah.
What's that?
CBD is a hemp derivative called cannabinoid.
Oh.
That doesn't have THC in it, so it doesn't get you high, but it is another cannabinoid derivative of the hemp plant.
Okay, so CBD, is that weed? CBD, I feel like has been used as like kind of a one-stop shop to treat a lot of ailments. Can CBD help with something like erectile dysfunction, to your knowledge?
No, is probably the quick answer.
Got you.
But CBD is used in all kinds of complementary medicine ways. There are lotions, other ways to take it, sprays, all kinds of CBD derivatives and ways it's delivered. There are a lot of people who are really strong believers in many health benefits of CBD, like making you feel more relaxed, or helping with inflammation. But to my knowledge, at least as a urologist, there's not any good peer-reviewed medical literature supporting the use of CBD in any form in sexual medicine for men.
So it might be something that might essentially like clear your mind, perhaps, maybe, because people would take it just as a form to relax and then that way maybe treat their ED.
So maybe there's like a huge psychological component to sexual function. And if you look at clinical trials in sexual medicine, the like placebo effects tend to be gigantic. And I love placebo effects.
Yeah.
You know,
probably make your job easier.
It does. And taking, if somebody feels like CBD is relaxing them, making them feel more comfortable, and they find that they're performing better in bed with CBD, that's awesome.
That's great.
So in that way, it might help.
Yeah.
But not in a real way where we understand a mechanism of action and we have clinical studies that show that it works.
Okay. So to your knowledge, Dr. P, are there any like adverse side effects or risks involved if taking CBD as a form to kind of like treat ED?
Well, first of all, I think it's important to note that CBD products are not prescription drugs, are not regulated by FDA. And like supplements or other over-the-counter products, you don't always know that you're getting what you think you're getting. So there's just an inherent risk there to begin with. CBD can potentially interact with certain medications. So it's important to, check with your healthcare provider, make sure it doesn't mess up any of your other actual prescription medical treatments. And some people might get tired, might find they're a little more anxious with CBD. So it has kind of unpredictable effects.
Yeah.
And I think, if someone feels like it's right for them, it's certainly safe enough to try, but, keeping all of those ideas in mind.
Things like fatigue and anxiety, I feel, are like, that's like the opposite of what you would want to get from an ED treatment. So do you know any alternatives to CBD to treat ED?
In fact, I do.
Yes, now we're talking.
Yeah, so of course, the oral phosphodiesterase 5 inhibitors, which are like the ED meds like Viagra, Cialis, those types of meds, and, any other treatment for erectile dysfunction. So you see a healthcare provider like me, or you interact with one of our partnered healthcare providers through HIMSS, try and figure out what's wrong. If you can fix the cause, you fix it, and talk through available treatments and pick one. And the good thing is that a lot of them work for a lot of people.
That makes sense. So CBD as a treatment for ED, we're not sure about. But what we are sure about is that you guys should come back to watch more Uncomfortable Questions, because I have plenty more. Dr. Pete has plenty more knowledge. So make sure you tune in, come back to Uncomfortable Questions so you guys can get more comfortable knowledge. I've been JC Mendoza.
Great talking to you.
Always great talking to you, Dr. Pete.
Nice talking to you all too.